Good afternoon, everyone. My name is Shiloh Jones, and I'm Senior Manager of Health Equity here at Families, and welcome to today's session. Let's give it another minute as folks are trickling in, and then we'll get started. And thank you everyone for joining so far. I just mentioned we're going to give it another minute or so before we get started with today's webinar. In the meantime, go ahead and put in the chat. I believe we still have the chat function where you guys are all dialing in from. I am here in Washington, D.C. And organization, if you can also. Thanks for everyone who already chimed in. Looks like we're from all over. This is exciting. Okay, let's go ahead and get started. As I mentioned before, welcome everyone. My name is Shiloh Jones, Senior Manager of Health Equity here at Families. And this is the first session in our new webinar series titled Health Justice Now. We put it in the chat before everyone started saying their name and where they're from, but this webinar series is an attempt to elevate health equity, obviously, but also showcase a variety of health justice topics, some of which we covered earlier this year in our Health Action Conference and other, as well as other initiatives within Families USA's overall equity portfolio. Some topics for the webinar series will include vaccine equity, reproductive justice, today's topic, which is federal health equity priorities, as well as state level recommendations on health equity. More topics will follow, and we also are very curious as to what you'd want to hear more about. But for now, let's get into today's agenda. So today is going to be kind of a lightning round. This is only a 30-minute session, and it's going to feature an overview of our Health Equity Task Force 2022 legislative and administrative priorities, as well as a general state of play with respect to funding and appropriations. That's going to be done by my colleague, Kenzie Marshall, Federal Relations Associate here at Families. And last, if we have some time, we'll just go over some immediate calls to action. Also throughout, please drop any questions in the Q&A tab. We will either get back to you via the chat, or we can follow up with you afterwards via email. Alrighty, let's see. Okay, so let's first go over the legislative priorities. There are 4 large ones here, the first of which is obviously concerning the momnibus. We want to push Congress to pass key provisions of the Black Maternal Health Momnibus Act, including those portions of the bill that passed the House as part of Build Back Better in December of last year. Congress should also pass the Medicaid postpartum package provision that extends mandatory coverage up to 12 months postpartum for birthing people after pregnancy. This provision also passed the House and Build Back Better, as well as the Maternal Health Quality Improvement Act. So an update here is, since obviously talks around Build Back Better are ongoing but informal, there's no immediate need for separate outreach to members of Congress and administration regarding the omnibus. However, if you already have a meeting set up, you could mention this as still being a top priority. Another thing I'd want to note is a fifth priority that we initially had in the priorities document, and I can actually share a link to the document that has all of these priorities listed out. We had the priority of reauthorizing the Maternal, Infant, and Early Childhood Home Visiting Program, MICV, and requiring Medicaid payment for home visiting. So obviously that Congress should reauthorize this program and require Medicaid coverage for evidence-based home visitation services to improve prenatal, maternal, and newborn health, as well as child health and development. So the MICV program actually is included in the president's budget, and as well as expand funding for the program. So that's why we took it out of this slide and in the document. It's expanded to an additional 165,000 families and includes an additional $3 billion. So we hope to see this included in the future Senate and House passed budgets. So the next bullet here is all about community health workforce legislation, and particularly funding. So we want to push Congress to pass the bipartisan Building a Sustainable Workforce for Healthy Communities Act, which was introduced by Senator Bob Casey and Tim Tillis. This bill aims to create a long-term funding source to grow the CHW workforce via a competitive grant program for eligible entities. So that would include state and local government, Indian tribes or tribal organizations, urban Indian organizations, as well as community-based organizations to develop or expand CHW programs. So this is also included in the president's budget. The president's proposed budget also includes Medicare coverage of services furnished by CHWs. All that being said, and as we all know, the president's budget is not final and will not necessarily be picked up by Congress. So if there are any certain line items that are important to you, I'd encourage you to reach out to your home state senator or representative, particular to CHW funding. So the last two are around CMS and CDC. The next is amending CMMI's statutory language to include advancing health equity as an outcome, in addition to reducing costs and program expenditures. CMMI has obviously been expanding its effort to build more equity-focused models for non-elderly adults and children, but want to make that more formalized in the actual statutory language. Last here is about the REACH program. We want to push Congress to fund the Racial and Ethnic Approaches to Community Health program. As of now, this is the only CDC program that funds communities working to reduce racial and ethnic health disparities. REACH strives to promote healthy behaviors and chronic disease management among 5 racial and ethnic groups: African Americans, American Indians and Alaskan Natives, Hispanics, Asian Americans, and Native Hawaiians and other Pacific Islanders. While there was some progress in funding made and reached this year through the omnibus spending package, that included about a $1.5 million increase, bringing the total to $65.95 million. We hope to see that grow even more. So next, I'm trying to, again, go quickly to go over our administrative priorities. And the line at the top is pretty much the heart of the matter. We really want to push on incorporating equity into payment models as well as to measures. So the first there is incorporating health equity into quality measures and performance-based payments, including incentivizing providers for reducing disparities in health outcomes. Next, we want to push the Biden administration to build on the Integrated Care for Kids program to establish a more fully specified payment and delivery model with CMMI authority that supports and incentivizes a focus on social, emotional, behavioral, and relational health of children, ideally as part of a high-performing pediatric medical home. Next here is we want to push that all future CMMI programs should demonstrate how they're implementing the Office of Minority Health's culturally and linguistically appropriate service standards, class standards, and so within CMMI. The fourth here is core health equity measure sets. So we're pushing HHS to undergo a multi-stakeholder process to develop a core equity measure set and require that Medicare and Medicaid payers and providers report on those measures. So this core equity set should be determined by a wide range of stakeholders, including those with lived experience, including individuals that identify as part of underrepresented, marginalized, or disenfranchised communities, and those who most experience health disparities. The fifth one there about data is this is going to be targeted mostly at OMB, the Office of Management and Budget. And then we're pushing them to develop protocols in consultation with community members, again, to as well as data researchers and users for the collection, use, and reporting of self-reported, comprehensive, disaggregated, and granular demographic data, as well as health-related social needs data. OMB should also consider adopting the National Academies of Science, Engineering, and Medicine, so NASEM. They have data standards, sexual orientation and gender identity, SOGI standards, once they become available in the fall in their final report. I think that should happen later this year. And lastly, we want to push the Biden administration to publish all interim reports and recovery plan and ARPA recovery plan performance reports collected from recipients of coronavirus state and local fiscal recovery funds under ARPA. The federal government should also ensure that equity is being achieved and how the funds are being allocated for states and communities, as well as the amounts being allocated. And I believe, hopefully my colleagues are keeping an eye on the chat. So if there are any questions or suggestions for future tweaks or future agenda items for our priorities, please do put that in the chat and we can follow up with you. So I think I will now turn things over to Kenzie to give a quick state of play and a federal relations update. So Kenzie, on to you.
Great, thank you, Shiloh. I'm hoping that everyone can hear me. Good, okay. So the House and the Senate are currently in recess for the next 2 weeks. And we're about to start the summer sprint towards the midterms, which is always a very exciting time. Congress did not advance COVID supplemental funding, which I'm sure many of you saw before the recess, before they broke. And last week, Leader Schumer and Senator Mitt Romney had reached a $10 billion agreement on a COVID supplemental package, but it fell apart on Tuesday after Republican senators said that they would not support it until there was a vote on Title 42. And as you guys may know, Title 42 allows for U.S. Customs and Border Protection, turn away migrants at the border to prevent the spread of COVID-19. This is the Trump era policy. The Biden administration has talked about repealing it. And there are a lot of Republicans that are very unhappy about that right now. So they do not want to move forward with COVID supplemental. I'm sure that will come up later in the spring and in the summer. When Congress does return from recess, we'll know more about the prospects for reconciliation, which is separate from the COVID package. The White House has been attempting to re-up the Build Back Better push, but they've been keeping everything very ambiguous and kind of up in the air without very firm deadlines. Senator Manchin has signaled that he's ready to start these conversations again, but he wants the bill to specifically focus on several things. The first is climate programs. The second is prescription drug reform. And the third is undoing the Trump era tax cuts. He very firmly believes that restoring fairness to our tax system and paying down the national debt is a critical priority. We've been eyeing a Memorial Day weekend sort of deadline on this push, but Senator Manchin has expressed that July 4th is his deadline for a Build Back Better package. Hill Dems do want to make sure that the package passes before the midterms, but for the most part, negotiations aren't very formalized yet. This is all kind of coming together as we speak. For some context on the budget, Congress passed the FY 2022 Omnibus Appropriations Bill back in March, which funds the budget through September 30th, 2022. As you can imagine, this does not mean that it's going to be an easy fall. With the midterms and the need to pass a budget or continuing resolution, it will be a very hectic few months. And as I'm sure you've all seen, the president released his FY23 budget proposal. which does cover many equity priorities that are very important. The thing to note about the president's budget is, of course, it's not the congressional budget. It's more of a guideline that's supposed to help Congress decide how they want to distribute their funding. Hopefully, we will be seeing Senate and House Appropriations committees release their FY23 budget text, but that will probably not happen until later in the summer. There are several appropriations letters that we want to flag for all of you. It's Black Maternal Health Week this week, and it's important that we continue to support the push, both in Congress and the administration, moving forward to support Black moms. The first letter that we want to plug is from AMCHIP, the Association of Maternal and Child Health Programs, and it specifically asked members of Congress to support the highest possible funding levels for the Health Resources and Services Administration, the CDC, and NIH, specifically to improve maternal health and eliminate inequalities in maternal health outcomes. The second is to reach out to your representatives in the House and ask them to join a letter, which is being led by Representatives Underwood, Kelly, and Alma Adams, to urge Leader Schumer to include maternal health equity provisions from the House-passed Build Back Better Act in reconciliation. And if you're interested in either of these letters, we will send around more information about them and the process for either joining them or asking your representatives to support them. A few more things of note. Secretary Becerra was on the Hill last week testifying about the president's proposed budget, specifically the Health and Human Services section of that budget. He spoke at several hearings on both the House and the Senate side. There was nothing truly particular of note that I feel is like really important to mention. They were definitely interesting hearings. If you have time to go back and listen to them, it's definitely worth it. But the one thing I did want to talk about was that at the Senate Finance Committee hearing, Chairman Ron Wyden focused on aspects of the budget that specifically talk about improving access to care, including telehealth, providing Medicare with the authority to negotiate the price of brand name drugs, behavioral health supports, and more. And in context, Ranking Member Crapo chose to speak about the solvency of the Hospital Insurance Trust Fund and the lack of savings in the president's proposed budget. They were very stuck on those issues, and I'm sure that will continue to come up. There is continued bipartisan interest in behavioral health in both chambers. We'll see that play out specifically in the Senate Finance Committee and the Senate Health, Education, Labor, and Pensions committees in the coming months as they work on moving forward with behavioral health legislation. The Senate Finance Committee has specifically talked about pulling together a package. So there's a lot of great movement there. And then two other things of note, the administration put out a notice of proposed rulemaking on fixing the family glitch. There's an open comment period if you're interested. And this week marks 100 days since the No Surprises Act came into effect. And we're still waiting for a final rule from the administration. That should be coming in May. But with all the present lawsuits, it's unclear how the administration is going to proceed. So all these things are very interesting. There's a lot going on right now. But if you have any questions about anything that I've brought up, anything that Shiloh's brought up, please feel free to let us know. And absolutely, Kelly, we will send some information about the sign-on letters.
Thanks, Kenzie. And I know we have a few questions in the chat. I'm going to try and go through them one by one. So the first question is, can you say more about how we hope that equity is being incorporated into quality measures? And yes, it's about stratifying. So essentially, it's about stratifying the measures for beneficiary demographics. So for example, race, ethnicity, and primary language at a minimum, and to move to incentivize a reduction of disparities across each discrete measure. So that's a way that we're hoping that we can get equity more clearly defined or more clearly centered when we're talking about measures. So the next question about what we mean by core equity measure set. So we're suggesting that HHS should go, and this is, I said a little bit of this earlier, but a core health equity measure set and requiring, so just, I guess what I mean by core is just that it needs to be acquired across all Medicare and Medicaid payers and providers to report on this set that would be applicable for adults and ideally children as well. So this core or like singular or central set would be determined by stakeholders, like I mentioned those earlier, those with lived experience, those who are actually part of the communities, those who, et cetera, et cetera. And then in terms of what types of protocols are you hoping to see for disaggregated data? So hold on, I'm looking through the priorities document, which again, we can also share the document that has more detail of on each priority. We can send that either on the website page where you could register for this, as well as maybe in the chat in a moment. So give me one moment, I'm just skimming now. And actually, let me just jump to the next one. So will we be actively seeking legislation to expand CMMI's definition? Yes, I think that is something that we've been in talks with CMMI about. And then another follow-up on the core equity measure set. Is it also the ones that we want to stratify or something separate? I'm not sure what you mean. So in terms of, yes, I think I understand what this question is. So the measure set would include those that would be stratified by demographics, as well as those that would stay, I guess, fairly uniform. So yes. And just wanted to actually read this out because I think this is an important point. So one equity issue would definitely be the elimination of the clawback provision for Medicaid in long-term care settings. It disproportionately impacts low to mid-income people and can force families out of their homes. Illinois and some other states have eliminated, but is there a plan to address this on the federal level? This I will take back to our Medicaid team, and I can get back to you, Miranda, on this one. So really quickly, let me just go to the next slide, which has a couple of our calls to action. So Kenzie, can I go back to you quickly just to talk a little bit about Maternal Health Week?
Yeah, so like I was mentioning before, it's Black Maternal Health Week. I will add more information into the chat, but there was a toolkit that was published by the Black Mamas Alliance that specifically gives more information about social and how you can engage. But it's a great opportunity to continue to reiterate to Congress and the administration that we need to do more to improve Black maternal health outcomes, and specifically Black maternal health outcomes in reconciliation text and any sort of upcoming package.
Thanks, Kenzie. And then another question I just saw in the chat: how are we building a broad coalition to push a short list of the above? I think more to come on that. I think we've been thinking through our health equity task force, which is the group that helped us create these priorities, and thinking about what we can do to create a coalition and to build some momentum around a couple of these things. I think some of this, I think most of I would say the priorities mentioned today are things that are, I would say, on the short to midterm like agenda, I would say. So things that we think are possible potentially in 2022 going into perhaps the next administration in Congress. So more to come on exactly how we're building the coalition there. But it is something that we're thinking about internally here at Families. And let me just look back at the questions. What type of protocols are you hoping to see? Cincy, let me get back to you on that as well. I want to make sure that I'm specific in answering that question. So I can email you separately on what specific type of protocols are we hoping to see for disaggregated data. Lastly, I think Kenzie, I think already plugged the two things on the screen here in terms of the letters to the Biden administration about Medicaid redeterminations, as well as the RFI on access to care and coverage. Deadlines there are listed. And with the last couple of minutes, and please do keep the questions coming, we're keeping a note of these and we'll follow up. The last thing I wanted to put on the screen is just some of our upcoming webinars in the series. So the next webinar is going to take place on April 26th. That's going to be featuring our vaccine equity team, and title is about lessons learned from COVID-19 vaccine distribution. The next after that is in May, and it's going to be one of a two-part webinars focused specifically on reproductive rights. Lastly, the May 12th webinar is going to feature a report coming out of our Health Equity Academy team on elevating community voices and how state policymakers can advance health equity. So with a few minutes to spare, I also wanted to flag if there are any future topics of discussion that you'd want to see in a future webinar in this series, please do let us know. I think we have a very quick poll just on what whether you found this particular session useful. And again, I'll actually drop my email in this chat as well if there's anything that we didn't go over. I know my colleagues are looking at the chat, so just wanted to flag that as well. And yeah, I think I'll pause here because I feel like I've been talking a lot, and note that there are some links being dropped into the chat, into the Q&A. And with that, I just wanted to thank everyone for taking 27 minutes out of your day. And let me see. Yes, we wanted to experiment with this shorter format, but I think the upcoming webinars are all an hour long, just as an FYI. So noted that 30 minutes is a bit quick for all of this information. Wanted to give the top lines, but it's hard to get a lot of detail in such a short time, but duly noted. With that, let me put my email. And again, thank you everyone for joining this afternoon, and we'll keep this webinar open a few more minutes since there are some folks still making contributions in the chat. And yes, let's get the link to the priority. And thank you, Janice, for the suggestion of evaluating the benefits and burdens of proposed legislation in advancing health equity. That should go on our list for a future topic for one of these. And I think we are at 12:30 now, so I'll go ahead and close out for this afternoon. Thank you again for bearing with us for this first session in the webinar series. We will work to follow up with everyone who asked questions. And if we haven't dropped the link to the priorities document in the chat, we'll make sure that that's available on the website where you registered for this webinar. Thank you again and have a great afternoon.